Well, good morning, Coalition. It's great to see everybody here, and we have a wonderful interview with Dr. Charlene Green, the president of the Old North State Medical Society, who practices at Cone Health System. But you're going to get to know a little bit about who Dr. Green is, and also about Old North State, because we've been privileged to have some information that she sent out to us. And so Virginia has shared that with the group, and we'll put that up on our website as well. Virginia, do we have any announcements that we need to make?
Only just the reminder that next Friday is our monthly meeting.
Okay, cool. All right, well, let's just get right into it, because we got a half hour. We have a half hour, and we're going to stop right at 9 o'clock. And so Dr. Green, it is a distinct pleasure to have you with us this morning, and people are going to put their information, who they are and what they, where they work, or what organization they represent, in the chat. And not that you need to look at that, but about halfway through the interview, we might have a question or two from individuals that I'll read off and repeat, and then that way everybody gets to be involved in this. But tell us a little bit about where you grew up and what you did when you were young, please.
Awesome. So I'm a Baltimorean. I grew up in Baltimore City, in Maryland, and I was born and bred, went to the oldest all-girls high school, public all-girls high school in the country, established in 1844. And I'm proud to say that one of our famous alumni was a federal district court judge that actually swore in Lyndon Baines Johnson on Air Force One at the assassination of John F. Kennedy. So, we have a lot of great alumni with that. So I was a chemistry major at my high school. And one of the things that of late, in the last couple of years, that I talk about is the subject matter learning that I had at my high school, because of course it was still during the Cold War. So interestingly, my chemistry teacher was Russian. And I think she knew about just what the Cold War meant to her. So she taught us everything she knew about chemistry. And her name was Mrs. Annalane. And so I became a subject matter expert on chemistry, so that when I attended UNC Chapel Hill as an out-of-state student, my chemistry at UNC was easier than my high school.
Wow.
Which most people can't say that, right?
No.
Got all A's in my chemistry classes, upper level math classes, because of my subject matter learning in school. And I'm going to come back to that later of why I said that. So after that, during that time in high school, I was able to participate in really some interesting programs that are in Maryland, in that DC area, because of the federal government agencies in that area. So I participated in a lot of DoD programs at Fort Belvoir, at the U.S. Naval Academy in the summers. Most of that I thought was fun, but it was more so subject matter learning and expertise, because at that time they were still trying to recruit a lot of people into the federal government to help during the Cold War. So long story short, I ended up going to UNC Chapel Hill, majoring in chemistry, which I absolutely loved. Went to University of Maryland and medical school. Actually went back to live at home for 2 years and in my same room for 2 years, and then eventually got an apartment with some other medical students my last 2 years, which is actually interesting because most medical students don't do that. They don't live at home. But long story short, participated in a program called CAP, which is called Combined Accelerated Program in Psychiatry. My medical school accepted 12 students each year for a psychiatry type program where you try to recruit psychiatry residents at the time, which I thought I was going to be a psychiatrist, and ended up getting the most psychoanalytical treatment you can ever imagine, because I think they were experimenting on us. I actually thought about that later in life. Really, I'm serious. Dr. Weintraub was the leader of that. So we met every week. We got advanced, classes for psychiatry. But long story short, after treating patients, by the time I was a junior, paired with the psychoanalytical psychiatrist, I decided I didn't want to do psychiatry because of what you guys already know. Most illnesses are longstanding, they are intense, and they're very hard to treat. So I ended up, going into anesthesiology because of the intense work I probably did with psychiatry, that I knew that I wanted to help people quickly, fastly, and more efficiently in a highly reliable organization. So that's why I chose anesthesia. It was a total switch.
Yeah.
But with anesthesia, basically it's all psychiatry, most of it. Of course, expertise with the chemistry and the math part with anesthesia. But basically, in a short period of time, I know anything about a patient, because they have to trust me and I have to know everything about them. So in a short period of time, I can find out everything about you. So that's a long story too. So that's a little bit about me. The most fun part about medical school for me was spending time and being selected to go to Guy's Hospital to do some training there to see how the European system works with healthcare, which is interesting. I got an experience to see, I have family. I'm from a military family, so I went to 2 military bases in Germany where I had family on 2, Ansbach and Nuremberg. So I got to experience Germany a little bit. So long story short, that's a little bit about me, and that's me.
That is exciting to hear all that, and to go to Guy's Hospital. Now, when did you actually? That's over in London, isn't it?
Yeah, it's in South London. So it's 1986. And I remember the exact day that Len Bias died, because it was European news. I did not know really much about Len Bias, even though I grew up in Maryland. I didn't do sports a lot, but it was on every channel, every news channel for like a week in London, Len Bias' death. Mm-hmm.
Very interesting. So you grew up in the Maryland, in the Baltimore area. You came down to Chapel Hill. You then went back up to the University of Maryland. You did your medical school there, but then you came down, I believe, to Duke to do your residency.
Correct.
Now, what was the draw to continue to come back to North Carolina, and then you stayed here?
Yes, I did. So I would say most of my life, except for about 5 years, I've been in North Carolina. After age of 18. So what brought me back here is that for many minorities that live in that area, my parents migrated with the Black migration to Maryland, like other World War II vets, right? So in 1947, my parents moved to Baltimore. My dad was a World War II veteran. And uncles were Vietnam veterans and things like that. But so went back to Maryland, trained. I skipped 1 year where we didn't talk about, where I trained at Sinai Hospital, which is one of the largest Jewish hospitals in the country. I loved it. And now it's affiliated with Johns Hopkins. So after that, came to Duke, did my anesthesiology training, did a pain fellowship, there as well. But really what brought me back is my mom was born in Burlington, North Carolina, and my dad was born in Greensboro. And, they experienced the Jim Crow laws in the South. So they felt as though they could get a better life when migrating to Maryland. So most of my neighborhood were all World War II veterans and all military, and it was a real true village.
Got it. Okay, so really, in some ways, you were coming back home, and as you mentioned, there were some real changes that occurred back even during the Lyndon Johnson era because of the Medicare transformation of hospitals and the integration of hospitals. So we had the privilege of showing the Power to Heal film. I don't know if you've seen that.
No.
but oh, you must see that. That's a wonderful film, and
Please send it to me. I will definitely do that. I don't watch, you mentioned good, something about the movie with Robin Williams. Like, I think as, many physicians, unless we, it depends on the specialty. I don't watch movies because it's 2 hours long. We don't have that much time. So I've never watched it.
Well, I understand that.
Mhm.
Well, I was just going to say, we'll definitely make sure you get a chance to see The Power to Heal, because it is
Absolutely.
about the desegregation of hospitals in the United States. And
So can I tell you a story about that?
Sure.
Yeah.
At the hospital that I practice in, I don't work for Cone Health. I contract, with my group is independent. But Old North State Medical Society was instrumental in the 1963 federal case, which was Simkins versus Moses H. Cone Memorial Hospital. That was with Dr. Simkins. He had a patient that had an abscess that could not be treated at the hospitals here in Greensboro. So he, along with one of my mentors, Julius Chambers, which is a really esteemed civil rights lawyer that we befriended many years before his death, actually litigated that. The district court here in North Carolina dismissed the case. It was appealed to the Fourth Circuit Court of Appeals by a 3-2 decision. That case was reversed, and that case provided the opportunity for every minority physician to practice in the United States, and they could not, be denied by race, color, or creed. That decision was November 1st, 1963. And interestingly, it was based on the Hill-Burton Act, right? Where the Survey and Construction Act, based in 1946, says that any hospital that was getting federal grants or loan money for construction couldn't discriminate. So that's how that case was won. And so I call that Brown versus Board for medicine for this country, because after that, the civil rights laws were passed in 1965. So that was the instrument for that. The Supreme Court basically refused to hear that case, so that was a stay. So we're famous here in North Carolina.
Absolutely, absolutely.
You'll definitely love The Power to Heal, because it tells that story.
Awesome.
And Dr. Simkin's statue there in the old courthouse in Greensboro is an icon. So we appreciate that.
Absolutely.
So you came down back to North Carolina. You did your residency in anesthesiology at Duke, and then tell us what happened next.
So I ended up getting a job here in Greensboro with the most amazing group. Interestingly, I call it was the Dookie practice. A lot of the people that were here in Greensboro, they were from Duke, two of which was, interestingly, two of my Jewish partners that I met and recruited me as well, which was an interesting story. That was Dr. Stanley Rosenberg and Dr. Kevin Ossie. Dr. Ossie just retired this year. He's from South Africa. But long story short, I've been on my job, it would be maybe 27 years now. And I can say, I know, right? I'm older than I look, right? So 27 years, I may be off a year or so, I don't know. But I started that in 1994. I would say I've never called in sick, right? Of course, you have to get coverage. I would say 4 times I would have to get coverage, 2 of which was when I, had pregnant, and I, didn't want to leave, but I had to go out for 2 days. But anyway, so I'm proud of that. So I've been on my same job, same group of people, actually. I mean, some of them are gone, but same people I started with.
That is amazing.
It is.
I've got to ask you, an old friend of ours and of Karen Bullock, who is on the call here or on the chat, we were good friends of a gentleman who is a neurologist, African-American, Dr. Rich Payne. Did you know Rich Payne at all?
I did not.
Oh, okay.
Did he train at Duke? Because if he trained at Duke during my time, I would know him, but
No, he didn't train at Duke, and he's since passed away, but
Oh,
he was a professor at Duke, both in the
okay,
medical school and in the divinity school. So,
okay.
Pain
and
management.
he was a neurologist, but was
Got
a
it.
specialist in pain management. So I was just
Okay.
curious. Well, anyway, that
Well,
was
he
just,
probably didn't come to the operating room. We're so targeted, as anesthesiologists. I see people's work, right? Any doctor in the state that have sent patients to Cone, I can tell you their work, and I can tell you I can tell you a lot of things about a doctor based on what I see how they've treated their patients. But if most people don't come to the operating room, they're not surgeons, I may not know them.
okay. All right. Well, it was just a possibility. So you have been in Greensboro for 27 years. So tell us about the Old North State Medical Society and how that has played into your practice, and you're now the president, and how that occurred.
Yes, well, interestingly, we brought up the Simkins versus Moses H. Cone lawsuit. So one of the people that was instrumental in that was Julius Chambers. He was a civil rights lawyer that litigated many Supreme Court cases. He's litigated one of the most profound Supreme Court cases, which was Swan case of Charlotte, the busing case, right? So we, because we had my husband played golf, and we ended up getting to meet a lot of the people with the NAACP Legal Defense Fund out of New York, of which Mr. Chambers was executive director some time ago. For many years, we became friends with many of the NAACP Legal Defense Fund people. And we ended up meeting Mr. Chambers, and he became a mentor to us. And vacation with him, many years. We would take him on vacation with us at the Greenbrier and places like that. Spend a week at a time with them, which I say that kind of interestingly, but if you ever meet him and meet someone like him, very rarely do you get to spend a week with a person like that, right? But anyway, so he actually, worked with Thurgood Marshall, and would basically told me that I had to make sure that I continue to work with Old North State Medical Society. And I told him, I don't do a lot of social things. And he told me I had to do it. So I would say that I promised him that I would, I had already worked with the organization before, but realized that, it needed, just some people like myself to, continue his legacy. So that's what I do. So basically, Old North State Medical Society was established in 1887 to meet the unmet healthcare needs of North Carolinians. It was founded with a few doctors, which pioneer doctors from Shaw University, which was the first reportedly medical school for African Americans in the country. So that was established in 1888, and then 1889, 1887. Old North State had been already, established with them. And so through the years, they've been fighting this fight of trying to help the vulnerable population to, get healthier outcomes. Of late, we're really working on closing the Medicaid coverage gap, of increasing, outcomes for people. But more importantly, now we're going on the line now of talking and advocating for Medicaid expansion aggressively. So you guys will be seeing a press release about that soon. Medicaid expansion, coupled with physician-led care, because some of the patients that, many of the patients in North Carolina are at-risk patients with increased acuity and social determinants of health. And those are the patients that actually need physicians. And so we advocate for that.
So you mentioned just at the beginning, maybe it was before everybody got on, but that in 2020 you were able to have a White House-led forum or conference on COVID and the Old North State Medical Society. Tell us about how that came about and what that accomplished, please.
So, of course, COVID-19 has just been horrific and it's not going away. We're going to have to learn to live with it. It is the most profound public health global crisis in a long time. So as everybody knows, most of the COVID-19 pandemic pushes have been actually has been pushed by the federal government policies, and of course, with the funding and things like that. So the Biden administration, when they've tried to figure out how to mitigate this virus better, they started going around the country and trying to recruit more primary care physicians to get involved and thank them for what the work they're doing. We had already been doing that work with testing and been at the forefront. Many people on the call may know that I've been one of the co-chairs for the North Carolina DHHS testing surge group, which actually was instrumental back in starting in April and May of 2020 of figuring out like, how do we reimagine testing? Then how do we get the vaccines implemented? So I've been a part of that group. And then also part of the governor appointed group with the Andrew Harris equity group. So all that said, the work that we did with Old North State Medical Society, I guess everybody would know about it. So we were asked when the Biden administration put that initiative out through states to be a part of it. And two of our doctors, Dr. Shackelford and Dr. Karen Smith, were part of that. So it was a big thing. I'm not into, the big people coming and things like that. I'm into strategy, execution, and policies. But, so I didn't participate, but we had two other people. I organized it, of course, but had the doctors that were primary care doctors, because those are the ones who need to get the kudos, right? They've been in the trenches doing this hard work. So they were able to participate. So we had Dr. Levine from the White House. We had, I think the Assistant Secretary of Health, with Governor Cooper, Mandy Cohen, all those, great people came, but really was to the doctors, telling them about like, what are they doing every day to mitigate this virus? So that's what that was about. In the emails that you guys have, it talks about that ad nauseum, and they actually have a video on it. So I think I may have sent you part of it, but part of that is a video that's included with that. So that's awesome. So you can look at that from from beginning to end. And so that was how that happened. I had already had some contacts with the White House based on just the work that we were doing. After that, and I can't remember if it was before or after that, I basically, wrote in, first of all, I wrote the White House and asked them, can President Biden come to talk? I don't know what was happening at the time. They were like, well, no, we'll just bring this COVID-19 coordinator. And I was like, good, I'll take him, but next time we'll get President Biden. So Dr. Shukair came to one of our talks, and he was actually instrumental in helping to guide, I think, the state with what was going to come with eventually the COVID-19 test kits and things like that. So that's how we've gotten involved. To me, it's just important to know the right people and ask for the right things. And I think North Carolina has done a great job with Governor Cooper and Mandy Cohen to mitigate this pandemic better than most states. In the next couple of years, you're going to see really in fruition, really what that was all about, but they did a good job.
So you and I had a conversation about 3 weeks ago, and we were talking about—
You're both on the Andrea Harris task force.
Yeah, and we were talking about the impact of COVID on the aging population and what your physicians and Old North State was concerned about on this side of COVID. Can you talk about that a little bit?
So, we were talking a little bit about like media narratives and how, sometimes things that can be sensationalism is what people want to hear. Well, what people don't talk about is the impact that the elderly has experienced with COVID, right? Because during that time when they couldn't have family come, they got sicker and they died more, right? And their problems didn't get better, right? they couldn't go to the hospital because they were scared at times, or we were trying to channel them to, hey, don't come if you have COVID. So everybody, they had a sniffle or whatever, said, I'm not going to the hospital. So a lot of people suffered tremendously during that time. And that was really the elderly, because many times they didn't have that safety net. You know, they didn't have those neighbors coming to see them that normally would come, because everybody was so afraid of COVID. So they actually suffered alone a lot. So I think that's what we talked about, but the acuity of care didn't change. It was just a Band-Aid on, we were just so focused on getting, if you have COVID, if you don't have COVID, but really they're social determinants of health issues, just like many of the low income and disadvantaged patients were neglected, right? You know, they still had diabetes, they still had hypertension, they still had stroke issues, they still had things like that. But instead of coming to the hospital at the times, they just died at home. And that profoundly affected me, because I knew that and I saw that. And that's what we had a conversation about. And I don't mind openly talking about that. Of course, we're all trying to mitigate this pandemic the best we can. We're not blaming any one person or one entity, but we have to reimagine the public health system in the future to make sure that the most vulnerable people don't get neglected. And that happened to be the elderly, many more than what people are talking about, if that's what we talked about.
It is. And I was just.
And I just want to, I think we actually talked about an incident where I had a patient that I had a patient that was elderly. And I said to Leader Severe that I mentioned race because he was a Caucasian gentleman. And I said that because I saw bruises on his face. And I immediately asked him a lot of questions. And he basically said that during this pandemic, he had to rely on a family friend. And I was like, is the family friend nice to you? Long story short, I wasn't comfortable with what he was telling me. So I immediately got social service involved with him and told him that there are mechanisms or services that I think that he could get. That's not my field of expertise. So of course, the nurses, during the pandemic, things was crazy. So he had to stay a little bit longer. I got a little pushback from it, but I was like, he doesn't leave until we get him seen. So he got seen. For some reason, he came back. This is the story I told you, but he came back another couple of weeks. I wasn't assigned to his case, but he saw me and he just yelled for me to come into his little space where he was getting a procedure. And he was like, he just seemed so happy. And I was so proud. And he no longer had any, problems. He said he didn't have to use that family friend because he was able to apply. The social worker helped him to get the services that he was actually mandated to get. And he was able to work on his own and get the care he needed and didn't have to use other people. And so that's what the pandemic caused too, of people getting people that were not, good for them in their spaces too. So that's what we talked about, I think, if I'm not mistaken.
It is.
That's tremendous. That is tremendous. And you are such a soldier in many ways for doing the right thing. And we are incredibly honored to have you join us today. We've got just another minute. Dr. Charlotte Sweeney is one of our faithful members. She's been with us since the beginning, and she's mentioned that she said, Dr. Green, you've got to write your memoirs for all of us and for posterity. And I know you said you don't give very many interviews, and we're tremendously honored that you have joined us today. And just in the last minute, if you could just say a word or two about how our coalition could be of more service to organizations like yours and to perhaps have a greater interaction together.
Well, the only thing that I can say is I'm quite sure you all collectively do individually things great. But if you can just give the opportunity to organizations like my group, we're a 501(c)(3) organization. We don't make a profit. We don't make money. We're not a for-profit organization. So one of the things I told the state and recently met with Cody Kinsley is that, we do yeoman's work and we don't get paid. Like I don't get paid for what I do, and I'm proud of that. But if if we can stop working in silos and work collectively together, we could be more impactful. Like what you talked about your bill, if we knew about it, we could all work together on things and not just you fighting it on your own. I would think right now fighting this Medicaid expansion together instead of all these silos would be more effective, right? There are 500,000 people that don't have insurance, but guess what? That's more now because a lot of people have lost their jobs. A lot of insurance was coupled to jobs. So what is happening now is people are just not getting the care that they need, and we need to fix that. But not just fix Medicaid, but fix the public health system and the hospital system so that we can get more strategic, effective, accountable care with OKRs, objective key results. I think if we focus on objective key results, I think everybody would be happy.
You are so amazing. Thank you so much for joining us and for answering these questions. And again, we are honored to have you give one of the very few interviews that you have provided, and you've inspired us. Thank you so much.
Well, I thank you all for what you do. And for advocating for North Carolinians, but particularly the elderly patients, because they are one of the things we talk about, and I don't know if I have it in some of the stuff I sent you, is that we're the voice of the invisible, right? You guys are the voice of the invisible. There are people that don't have money. They can't give money to from things. So who takes care of them, right? Everything is not always transactional, right? So I would just only the words of wisdom that I would leave with you guys is, I'm a capitalist. I love capitalism, but at some point, humanity should come first.
Well said. Well said.
Thank you.
Thank you so much. You've got some real advocates here. There's a lot of clapping hands.
Yes, thank you. Bye-bye.
Bye-bye.
Take care. Y'all have a great weekend.